So hey guys, welcome back to another video where we, the digital health guys, you may have noticed, we've done a little twist on the channel, talk about the basics of digital health. So if you saw the video last week with Ant, he talks about what is digital health. And this week, I'm going to be talking about the people involved in digital health. Who are they? Where are they? And the roles they play. So naturally, I'm going to start with healthcare professionals and who do they include. So the nurses, the doctors, the physios, the pharmacists, pretty much anyone with a patient-facing role. Doctors are often on the front line, and naturally, they play a key role in the adoption and use of digital health technologies. And what does that mean? So there are tools that doctors use that fall under digital health that help them make better clinical decisions, allow them to offer personalized medications, personalized medicine, and something I'm going to spend a lot of time talking about, even the computer systems they work on. So the most popular and the most common digital health tool that we all come into contact with, and we may not even realize, is what we call an EHR, an electronic health record. And I know a lot of hospitals in the UK are transitioning from pen and paper to record and document to these electronic systems. In our hospitals, we call it Cerner. Your hospital, you might be calling it Epic, System 1, EMS. There's loads of terms, but at the core of it, they are called electronic health records. And these are systems where you can have information about patients, their past medical history, their previous admissions, their blood test results, their images. And these are what help us kind of make that diagnosis, put the investigations together, and most importantly, allow us to document. And before, when you used to pen and paper, which used to get lost, when someone was using those notes, someone else couldn't document. This is a system that the whole healthcare professional or the whole team can use when it comes to the delivery of care to patients. Another example of digital health is when surgeons and nurses use remote patient care monitoring. It's when surgeons do an operation on a patient and they send them home. And you might see them fiddling around with an app on their phone. And it allows them to inform the surgeon if there's any issues, if they're noticing any pain. There's now even apps where patients can take pictures of their sutures, pictures of where the surgeon made the incision, and show the surgeon if it's infected, if it's hurting them, without having to go through the whole motion of coming into A&E, waiting for hours on end, to then be seen by a surgeon to only say the redness is just a natural part of healing. This is how digital health not only belongs into the hospital, but is now starting to be involved in a patient's own home. Nurses. You're probably thinking, how do nurses get involved in digital health? What role do they play? Well, if you've seen a nurse record OBS on a computer system, that's digital health. They might have been given an iPad where they come around and record your news, your blood pressure, your heart rate, your temperature. The act of doing that, the tools they use actually fall under digital health. And nurses, if you've paid attention, have been doing this for years. And with this new concept of virtual wards, remote monitoring, it extends the reach of nurses and their patients. So digital health for nurses isn't something new. In fact, it's been done for many, many years. Nurses have a play, doctors. What about pharmacists? So pharmacists also use digital health. They use apps and software to help them when it comes to prescribing the right medications, to ensure there isn't drug interactions, to make sure they're given the right dosing. AMS mentioned a company the other day called Caplet, which allows you to get your medications delivered 24/7. Doctors aren't using the app, patients are, and pharmacists are. So when it comes to digital health, it isn't just for doctors or nurses. Anyone that is having a patient-facing role or is involved in the care of delivering care to patients is involved in this journey of digital health. So digital health isn't just for the clinical team. Patients are massive beneficiaries of this as well. Digital health tools, apps, platforms, whatever you want to call it, allow patients to get more convenient and easy access to their care. They allow them to know more about their condition. Empowering patients through education is a hot topic right now. And it's allowing them to have an equitable role in the care of their management and their conditions. And with the rise of digital health, it now means they can have a bigger say in their condition and maybe even have better management. Patients can use apps to record their conditions, connect with doctors easily. They can signpost things, red flag things, speak to doctors. It allows them to manage their conditions better. There's so many apps now that remind patients when to take their medications. When I was working in acute medicine, we had a lot of patients come in because they weren't taking the right medications. They were missing out. They weren't getting refills delivered. And when you have apps that remind you when to take it, or when you need to go see a pharmacist because your medications are running out, it means there's better compliance, which in effect means you're managing your condition better. So digital health is also something to do with patients. So this is the one I'm really interested about, and we don't really talk about. It's the entrepreneurs and innovators in digital health. So these are the people that actually come up with the idea of a digital health platform or a solution. They may be clinicians themselves or non-clinicians. They may have spotted a problem and realized how they can use technology to solve it. It might mean helping the NHS save more money. It might mean how they use software and even AI to reduce the waiting list for people waiting for surgery. But entrepreneurs and innovators are the people who dream up of these ideas, who find problems and then deliver these solutions. And the key thing here is they work with patients, they work with clinicians and the wider healthcare professionals to kind of bring these solutions to what we like to call the market. So there's a big player here when it comes to digital health and the people and the roles they play. It's hospitals, the trust, the clinicians and the managers. You probably don't see them on a day-to-day basis. They're not on the wards, they're usually in the offices. But it's actually them who ultimately sometimes have a big decision if a digital health app or a platform is integrated into your day-to-day work. But they use digital health for a different reason. They use it to help patient flow. You're probably hearing there's not enough beds, waiting times in A&E are taking, more than 24 hours. This is where digital health tools and automation help with the flow of patients. They reduce errors. They help increase the patient satisfaction. So digital health isn't just for situations and positions where you're facing the patient. It's also the stuff on the back end. Flow, systems, payrolls, automating schedules, rotas. So they also have a big role in the implementation and adoption of digital health. So this is super important to know. When you're thinking about digital health, and in this series, we want to talk about all the people. And the people that sometimes don't get the limelight or get forgotten about are the tech guys, the software guys. Think about, when's the time you call IT, right? Your login isn't working, you give a call to IT, your smart card has blocked you out, you can't get access. But behind the tech, behind these nice fancy designs and buttons and colors are what we call software engineers, the tech guys I like to call them. They're the people that code the software to allow you to do what you do. It's not just smart cards, it's not logins. They take an idea or a problem and they design it such that you have a working piece of tech or a product. Now it's time to talk about the bad guys when it comes to digital health. Have a think who you think will be the bad guys. But in essence, it's the regulatory and compliance officers. So these are the roles that often gets a bad rep. They are the people that are essentially the gatekeepers from digital health when it goes out in the real world. And their job when it comes to digital health is making sure this new app, this new software, this new platform, it might be fancy, it might be glitzy, it might say it's going to solve X, Y, Z, but is it really making an impact? Is it safe for patients? When you record patients' details on this app or software, is it safe? Is it being shared with anyone else? Can other people access it? So the regulatory and compliance people, their role in digital health is to make sure, are these products safe? Are they effective? And they're actually having the impact they're saying they're going to have. In a separate video, we'll probably talk about data sharing, where does all this go, who collects information, who owns the information. But for today, the purpose of this video was to talk about the different roles. And just kind of recap, you have the clinicians on the shop front, the doctors, the nurses who are using these apps to record your blood pressure, to help you diagnose, even using the electronic healthcare record system to document for ward rounds. You then have the managers, the senior execs who think that digital health and innovation may help them, make the transition of patients through the system quicker, smoother, rotas, workforces. You then have the guys that build it, the software, the tech guys, and you have the compliance and regulation. The purpose of the video is to show digital health affects everyone in healthcare at every aspect of the patient pathway journey. It isn't just doctors, it's nurses, it's pretty much everyone. So this is part of the series where we talk about digital health, breaking it down into a series. And if you think we've missed out anyone, leave a comment below about who else you think plays a big role in digital health and innovation and how it helps them and patients. We'll see you at the next one.